questions.
Thank you. The floor is now open for questions. If you do have a question, please press star 1 on your telephone keypad at this time. If you're using a speakerphone, we ask that while posing your question, you pick up your handset to provide favorable sound quality. If at any time your question has been answered, you can remove yourself from the queue by pressing 1. Again, ladies and gentlemen, if you do have a question, please press star 1 on your telephone keypad at this time. Our next question comes from Mary. You may ask your question.
Yes, my sister had a fall back on ice last year, and she's a teacher, and when she is trying to write, she's got, I guess, osteoarthritis in her wrist, and her finger that she uses to hold her pen becomes numb. Is that related?
Related to the fall, you mean?
Not related to the arthritis in her wrist.
Yeah, I mean, one of the problems with osteoarthritis is that the joint tissues actually react to the disease. And oftentimes that's accompanied by forming additional bone. Not as badly as rheumatoid arthritis, which is an autoimmune disease where everybody is under attack. But when in osteoarthritis, when that extra tissue forms, it can pinch nerves. So you can have compromised mobility or compromised sensitivity as a result of this type of reaction. So it's possible.
When she had the trauma, if she had been treated within 48 hours, would she not develop the osteoarthritis?
It's possible, but there is no data out there to support anything right now because nobody has done the experiment yet. As I said, I mean, your sister had a fall, so that was good in the sense that she knew when the disease possibly started. But very few people, well, there have been no study as to, okay, what happened, can you do something in the first 48 hours? Because generally right now, the approach is that if you have a trauma, you would want to let everything, all the inflammation, all that stuff subside first before you do anything. Nothing wrong with that. It's just that you may have also missed that window. So that's something, that's why we think using our micro tissue system, we'll be able to test that without testing it on human first, because you don't want to just do experiments on people, obviously. But you can use this model to do it in the laboratory to get a better idea.
Thank you, sir.
Uh-huh.
Our next question comes from Darlene. You may ask your question.
Yes, I have what is called, PMR, polymyalgia rheumatica.
Right.
I have arthritis real bad. My hands are deformed, and my hip and my knee are very bad. But then I got that. Is that related to the arthritis?
Yeah, that's more of a systemic disease, related to autoimmunity and so on. So it's quite different from osteoarthritis. Osteoarthritis is more prevalent, but so as far as I know, there is no immune response related issues. It is more trauma, aging, wear and tear, this type of thing that cause this. So those are quite separate diseases.
Oh, they are. Okay.
Yeah.
Well, thank you for your answer.
Thank you.
Our next question comes from Linda. You may ask your question.
Hi. I have OA in my knees and in my hands. And the hand doctor says replacement. And I said, if I'm not going to replace my knees, I'm not going to replace my fingers. And I'm wondering, again, about Syndis. I've had very good luck, have used it for almost a decade, Synvis and steroids in my knees. Had a steroid injection in my right hand. It helped, but I'm wondering about the about the Synvis in my hands also.
Yeah, I mean, as I said before in, I believe it was Isabel's question, Synvis is a natural material. It is a lubricant, and it should definitely help. How much it helps, we don't know. It depends on how bad the structure of the joint has become. Obviously, if the joint is in very, very bad structural shape, just enhancing the lubrication is not going to do too much. But on the other hand, it certainly is the first thing you want to try. As I said before, none of these things actually cure the disease, but if it can restore functionality and reduce the pain, then it's worth it.
Is there any studies out on hand injections?
I'm not aware of extensive study. There may be some isolated case reports, but certainly not extensive study. It's mostly done in the lower limbs, the knee and particularly the knee.
Okay, because I suggested to the hand doctors that they look into it, and that's about as far as it's gone. Thank you so much.
Yeah, I mean, what I just want to add also is that, as you know, it's very obvious that the joints in the hand are very small. So you are not looking at a lot of allowance there for deformity or structural problems. You know, the knee is pretty big, so if you're a little off by a little bit, you know, and you can put some lubricant, you probably feel better. But the hand, I mean, you don't have a whole lot to work with. That's the problem.
Our next question comes from Carolyn. You may ask your question. Carolyn, you may ask your question. Okay, our next question will come from Carol. You may ask your question.
Yes, thank you for that very extensive review of the research and the findings and cautions and so on. I'm most appreciative. I was diagnosed with RA about 40 years ago, and I'm now almost 75. 5 years ago, I was told by a rheumatologist that it had gone away. It was no longer present in my body. I had never heard of that happening to anyone before, and I was wondering if you were aware of that, and is that really possible?
So RA, as you well known, since you were a sufferer of RA, is an autoimmune disease, right. And your body is essentially producing a lot of things against your own body.
Right.
Those processes, first of all, where they came from is still being worked on, and how are they maintained is not totally well known. So it is possible that autoimmunity can go up and down. That's not unheard of. For example, lupus, which is a very serious autoimmune disease. You know, people have for example, gotten a little older and then somehow gotten better. And so it's not a mystery totally, but on the other hand, there are a lot of things we don't understand. And also, as you well know, particularly in the case of lupus, women get it about 10 times more than men.
Right.
So there are some gender-associated mechanisms working as well. So it is possible that your RA has gone away, quote unquote. But remember, the gone away is based on blood work, right? They tested your autoantibodies and so on and so forth. And then if not there, they say, well, it's gone away. But gone away doesn't mean that it will never return, right? Hopefully it doesn't return, but no guarantee. So the answer is it's certainly possible. Autoimmunity is not something we understand totally, and it is possible that the activities go down. But just be thankful for that.
Yes. And I do also have OA, and I was especially interested in are there specific recommendations in terms of lifestyle that a person can do to further help the body heal or at least not get worse?
Right. So the probably the most reliable way to get improvement is to improve your physical state. As you know, it affects joints that move. So to some extent, you say, well, if I don't move, then it won't hurt. Well, that's kind of true. But remember when you move, the movement is not caused by the cartilage and bone. The movement is caused by the muscles, right? And all the ligaments that support the joint. So if you have a better set of muscles, that will help a lot because it will strengthen the way the joint is held together. So it won't wobble, it won't move sideways when it's not supposed to. So if you can do the type of physical exercise and conditioning that will enhance all the muscles around your joint, and there are many, many such exercises. Your physical therapist can show you all these things. All of them will contribute to the stability of the joint, which therefore will diminish all the discomfort and pain and so forth associated with the bad cartilage inside.
I appreciate that because when I retired, the first thing I did was got a trainer, and I still meet with a trainer twice a week and really take it very seriously, plus carry a pedometer daily. And yes. I feel it's really helped me a lot.
Yes, those things definitely, that's the one thing you can do. For sure. You can't take care of the stuff inside, but you can take care of the stuff around the joint.
Right.
Yeah.
Well, thank you so much. I really found this very informative.
You're welcome.
Our next question comes from Alexandria. You may ask your question.
Hello. I have two questions and also a statement. I just want to say the stem cell research sounds incredibly brilliant. My mother has OA, and at this point it was caused by a trauma at work, and at this point she has bone spurs and even blood marrow leaking. When it comes to this point, especially when those occur, is total joint replacement a better option than waiting for other treatments to start working, because she has had injections and the like?
Yeah. Is that the knee?
Yeah, it's both of her knees and her lower back.
Right. Yeah. So as I said, hopefully I made that pretty clear, that total joint replacement is a very effective procedure. In fact, there was a study not that long ago that kind of assigned each medical procedure with a happiness index as a function of how much money you spent, and total joint replacement is way beyond any other procedures as the number one happiest procedure, meaning after you do this, your quality of life improves, your self-esteem improves, and so on and so forth. It's a very effective procedure. The only drawback is it doesn't last forever, unfortunately. So depending on her situation, if the joints are really messed up, right, and then there is, of course, associated tissue problems around the joint because you were not able to move it very much, so your muscles undergo atrophy, and there may be some damage to nerves and so forth and so on. Then you probably ought to just go for total joint replacement, which of course is a very invasive procedure and has risk and all the stuff that your physician will tell you. But on the other hand, it does work. So to some extent, you are balancing the two. Now, if she has problem with both knees, then you need some drastic change, right? Because not be able to use either knee, both knee is bad news. I mean, she's compromising her quality of life tremendously. So I think you need to take those things into consideration. If you have one good knee and one bad knee, you're hobbling a little bit, you can say, well, I can wait a little because I can still manage. But if you are compromised on both sides, then you need to make some big decisions. So definitely think about this seriously.
Yeah. And I just have one extra question. I have RA myself. My mother had it growing up. Since there is genetic attachments, it's seeming, is it possible that I would be predispositioned to developing OA myself? Because I'm only 24, so I'm trying to keep on top of everything.
Yeah. So the answer is there's a high probability, obviously, but a lot of that. I try to use that analogy of the pothole. So you start out with material that's not as good as some other highways, the genetic material, because of perhaps a susceptibility, but that doesn't mean you can't work with it. So as I answered the previous caller, if you can keep your body in good shape, so there's nothing wrong with your muscle and everything at this point, hopefully, and you can develop a lot of physical measures in your body to maintain the stability of your joint. And of course, don't do crazy things that will cause trauma to your joint. Then you should be fine. I mean, you should have a reasonable and, in fact, maybe a perfectly normal set of joints to work with for a long time. So, but knowing that you may have that susceptibility, and then coming up with a regimen where you stick to and you can get your body in good shape at all times, that will help a lot. So I wouldn't necessarily worry about it, but if you don't do anything about it, then that's not good.
Okay, thank you so much.
Yeah.
Our next question comes from Carolyn. You may ask your question. Carolyn, I believe you might be on mute if you're trying to talk to us. Okay, our next question comes from Marie. You may ask your question.
Hi, I'm 64 years old, and no one else has mentioned anything, and you've certainly talked about total replacements as an option, and I've had 3. I've had both knees replaced, and most recently, a few months ago, I had a total shoulder replacement as well. I have to say that for me, I waited too long before I got my first knee replacement. I was afraid, and I think that was a normal response. I tried everything that you've mentioned in terms of the pharmaceuticals and the fish oils and all that, and the whatever I called it, the gel shots, but I don't know how to say it, but I tried all of that, and basically none of them worked. So I bit the bullet, and I had the knee replacement, and it has been tremendous, absolutely tremendous. Unfortunately, and I had already been going for a water aerobics class to be able to exercise in the pool, and that helped a lot. Unfortunately, other things started happening, and like I said, at this point, I'm waiting. Next week, my doctor said I can go back to the pool, but as long as I take it easy, so to speak, and I'm waiting to find out from the physical therapy what exercises to do for my shoulder. I guess what I'm trying to find out is I've been very, very, very concerned about my bones because here I am, 64 years old. I have 2 knee replacements, and I'm thankful that I had it done because I can get out and do everything without pain. And like I said, I'm still recovering from the shoulder, but I just kind of look at myself and say, what else? What am I doing or wrong, so to speak? except that, or what else should I be doing?
Well, so I'm very glad that Maria, that your total joint replacements have given you such satisfactory outcomes, because that really, as I said before, is the number one happiest procedure. So I'm not quite sure what you mean by taking care of the bone. I mean, you have is your bone density okay or not?
Yes, the bone density has been fine.
Well, so then I don't think there's that much you need to do at this very moment, and you're able to get around. And as I said before, the materials that make up the total joint replacement are perfectly stable materials. They will shred a little bit as a function of time, but those things are minor compared to what happiness that they give you. So the only issue, as I said, is that interface. Right. Remember, the metal shaft is going straight into your bone, in the middle of your bone, and it's staying there because your bone is grabbing onto it. Right. But that will loosen. It won't happen right away, but eventually it will get loose. That's the way life goes, and because that doesn't belong there in the first place. It was not part of your body, and so that's when the challenges come. Now, you may say, well, can I delay that, or can I minimize the chance? Yes, of course. If you don't go out and play football, then it will be much better than someone who has a total joint replacement and goes out and play football. So you need to take it easy. You don't want to do these things that will stress that interface. Right, so walking is fine. Some usual physical exercise is fine. No sudden, heavy weight bearing type of thing will be very good for you. So yeah, so it should give you, as I said, everything is a statistics, of course. The 10 to 15 years is a statistics. There are people who have total joints for 25 years. And but then there are also people who have it for 3 years. So if you do everything right, meaning you don't overly stress these artificial joints, they will give you a long period of function. So I wouldn't worry about it at this point.
Okay, thanks.
Okay, Dr. Tuan, I do not have any further questions at this time.
No, I'm done.
Would you like to make any closing remarks?
Yeah. Well, thanks again first of all to Arthritis Foundation for hosting these forums. I think they're very informative, both for me to hear from the community as well as hopefully for all of you. So I think right now we are at a very exciting stage on the research on osteoarthritis because of the following thing. Hopefully we have now gone to the other side beyond just kind of a suppress the pain, suppress the inflammation, suppress the secondary reaction type of approach. We are now hopefully going to go into actually dealing with the tissue defect that results from the disease. So if we can come in and say, look, we know we've gotten to a stage where everything hurts. If we can come in and we just patch it all up, again, using my pothole analogy, we have come up with the perfect tar to put into that hole that not only will it fill the hole, but it will also restore function. So if you drive on it, you won't even notice that there used to be a pothole. So I think we're at that stage in using technologies in the stem cell area, the smart biomaterial. I think we can get there pretty quickly. In my own lab, we've done already large animal studies that show the feasibility of such approaches. So I'm very hopeful that in the next 5 to 10 years, we will be able to come up with a resurfacing, reparative type of technology to help people who have osteoarthritis.